Hello, good afternoon.
Mr. Cho, you wait a while. Mr. Cho, you wait a while.
Hello, good afternoon.
Good afternoon.
Minister Wan, MP from GRC, Arjun GRC, and Mitsuki from Militarized MC. On behalf of some of the residents, I have the following to feedback and sought your answer. Medical costs have increased sharply in the recent years. Some residents wish to know if the minister is helping to tame this rapid rising medical costs and bring charges to weigh the needs of elderly. The elderly felt that with their legal savings and low Medisave funds, they are the most vulnerable, as medical facilities and resources may be beyond their means to save in times of needs. Many may opt for silent sufferings and forgo treatments for serious life-threatening illnesses or chronic illnesses when faced with shortage of money. Thank you.
Thank you, Mr. Lim. May I ask, Mr. Lim, do you have Medisave? You do, right? Your family will have Medisave. Do you buy?
Yes.
Do you buy Medishield insurance, for example?
Oh yeah, very shields. I've got income advantage shield.
Huh?
Income advantage.
Oh yeah, many shields. But don't buy too many because they cover the same thing. And insurance, if you buy 2 or 3 shields, they may just pay one bill.
Excuse me, I only buy one shield.
Okay.
That's for income.
Very good. For income shield.
Yes.
Yeah.
I also felt that recently the charges are went up very high.
Yeah.
And understood that a few years back, the hospital charges went up by 30 or 40%. It is a bit frightening.
Thank you.
So the residents are concerned that they're old, they miss the boat maybe in the early days, so their funds are very tight.
Yeah.
Depending on children is not fair.
Yeah.
So they feedback saying hopefully the minister can have some magic wand and help us.
Thank you very much. I have no magic wand. But I can correct a mistake. Cost don't go up by 30-40% in the last 2-3 years. I mean, there's cost increase because salaries do increase and we have to pay our nurses or doctors properly. So cost increases sometimes are inevitable. I mean, we always agonize over when costs has to go up, but not to the order of 30-40%. But the important thing is we look after ourselves, and when I talk about 3 M's just now, so that's why I asked about Medisave. For those who are working, it's not a problem because that's compulsory. Self-employed, I worry a bit. Actually, it's compulsory, but half of self-employed still do not contribute to Medisave. And it's very hard to compel them to pay because, you know, how can you send a self-employed to jail for not saving? Very hard to do that. So we can only encourage them, please, for your own sake, save while you are young. And a few dollars a month can make a lot of difference in 10 years' time, 15 years' time. And having saved in Medisave, and very important, please buy insurance. So Medishield is important. Or if you want to top it up, you buy a private shield like income shield. And please remember your spouses who do not work and they will need your money to pay for Medishield too. So buy for your wife as well and buy for your children. And those who are more than 40 years old, you also need to buy ElderShield because that's for long-term care, that's for nursing homes and so on. Because Medishield is only for hospitals. But ElderShield, then you also need to buy. Mr. Lim, if you are, I assume you are more than 40? 40 years old? 60. So do you have ElderShield? Sorry? You have, is it? Your wife also have ElderShield?
So she doesn't want.
She doesn't want.
They say it's very sweet to.
不要这样讲了，讲ElderShield就有生意了。ElderShield是为大家好的，有利，一定要 like life insurance, you know. How can you say sui I don't buy, you know? So a few dollars here and there, you pay a premium, and then you have peace of mind. Doesn't mean you buy, you'll die tomorrow or tomorrow.
Oh no, but our principle is we are personally responsible, keep ourselves fit, healthy, exercise, diet, proper habits and practice should be okay.
不过天有不测之风云，因为 you can, it's true. I mean, you talk about accidents. You can keep fit, you can do all sorts of things. You cross the road while you are listening to your handphone. A car comes along.
Oh, that I have taken care by buying a personal accident.
你真的千万不要误导这些。Elder show is very important. You can't buy it. Yeah.
I think I agree with you on this point, but that is not. Individual has different view. My wife has different view. I respect the view.
Of course, your wife is lucky to have you, good husband, who will definitely look after her regardless. But we are talking about not so much the spouse will look after you or not as money. Because the idea of insurance is every month I pay a little bit. If I need to use the service of the insurer, you hope you never have to use it. But sometimes bad luck, you need to use it. And some people get into a stroke, and all of a sudden they have to be to a nursing home. And without subsidy, it could be a couple of $1,000s a month. So 1 year is $20,000. Whereas if you buy Elder Shield, especially if you top up with a private Elder Shield, which can pay up $1,000, $1,500 a month, let's say, then it helps to reduce the bill, your burden. So I strongly encourage everyone, minimum, buy an Elder Shield. But those who can afford, top it up with an Elder Shield supplement, which will then have higher payout. Of course, the premiums is higher. It's very important. But we will do our part to try to control healthcare costs. But we need Singaporeans to support us too, because every now and then we have patients coming to our hospitals and demanding, I want a CT scan, I want a scope. Whereas those decisions, please leave it to the doctors. They will decide, do you need scope? Do you need an MRI? Do you need these very expensive drugs? Or some cheaper drugs will do. That is our job, that's our advice to the patient. But increasingly now, we have patients come with internet printouts. You say, hey, I read about this. I want this. And often, we have complaints on the ground because our doctors try to do their job by being firm with them and say, no, you don't need this. It's just waste of money. But they insist on doing so, and that's how healthcare cost goes up. So I think it's important that I'll do my job. I need Singaporeans to help me too. So cooperate with us. I think I trust the judgment of the professionals. But as Mr. Lim rightly put it, prevention is better than cure. So look after your health, exercise, eat less salt, eat less sugar. 肥鸡肉不要吃太多。